All right, okay, call for speed, please.
Sound and speed.
Louder.
Sound and speed.
Okay. All right, let's mark it.
Okay, Mark.
After eating docuseries, Carrie, take one.
All clear and everyone settled and quiet. Okay, and on your call, sir.
Carrie, if you can tell us your name and last name, and then also the organization that you founded.
Yeah, my name is Carrie Schirato, and I am a co-founder of Reclaim611, which is a nonprofit organization here in Dallas area.
Carrie, tell me, what is the purpose of Reclaim? What do you guys do?
We equip and train healthcare professionals to recognize, respond, and report victims of human trafficking within the healthcare setting. And we use evidence-based practice and trauma-informed care, patient-centered care, and protocol implementation within the hospitals so that when victims are identified, they know what to do safely so patients aren't sitting in the emergency room for hours and hours and are well taken care of and can get to a safe place.
A little bit about your background, Carrie. Even before you got to trafficking, just talk to me about your educational background.
Well, I've been an emergency nurse for 14 years. Everything has been in ER. That's really my passion. About 6 years ago, I went back to school to be a nurse practitioner. So I have a family nurse practitioner certification, and then I did a postmaster's in acute care medicine. So I'm actually dual certified as a nurse practitioner. But really, all that to say that I've done ER for everything. So.
When in school, did you have a designated class? You may or may not want to share the university you went to that taught you about sex trafficking.
Absolutely not.
Talk a little bit about that. And at the time, maybe it wasn't even in your universe.
No, it wasn't. Actually, in medicine and nursing, we talk a lot about child abuse. We talk a lot about domestic violence, but never have I ever heard the words human trafficking ever in a class or in a hospital in my entire career.
Is there a need for that? And do you think we should be able to see it implemented on campuses, in nursing school, in medical school?
Yes. I mean, the earlier you can get trained to identify and have the eyes to see victims of trafficking, the quicker we're going to stop this epidemic. We need people to know while they're still learning and they haven't been jaded by their profession, and a fresh look to really know what they're looking for and how to respond in an appropriate way, because it's really just not taught right now.
Give me an idea of what that would look like. If we could just walk through a practical scenario. A girl comes into the ER, concussion maybe, bleeding, cut bleeding, maybe there's some triage needed, cut eye, broken hand, something needing ER services, right? What would it look like if there is a nursing staff that knows how to identify? What benefit would that? To walk me through that process versus them not knowing. Time spent in the ER, maybe a girl coming and going without getting any service. Just play the two parts for me a little bit on role play on what it would look like if she walks into a situation where there's people that actually know what's going on, but she doesn't signal out. Mm-hmm. And what does it look like when they don't know?
Well, as a patient who's coming in and a nurse that's taking care of them, I think the first thing is really to know your red flags. So when you talk about human trafficking, there is a huge umbrella of vulnerabilities. And I think one of the things is to know what a vulnerable person is and the red flags of a vulnerable person. And so as they come in and you're questioning them under normal triage questions, and you know these vulnerabilities, you should be able to start making a mental list of what you're concerned for and more questions that you would need to ask. So as providers and nurses, we need to know how to ask the right questions. and looking for these vulnerabilities. And then once they may be identified, they need to know how to continue their care in a trauma-informed way so that they don't feel like they need to leave, they don't become more anxious and just leave our emergency rooms because we didn't do this well, because they don't feel safe. So we need to equip the nurses and the staff and the doctors, physicians, everybody on how to talk to them, how to interview them, and how to implement trauma-informed care as we're caring for them so that they don't want to leave. And they feel like they're in a safe place that they can trust. And they need to know what to do if there's a trafficker or a pimp in the room. How to deal with that scenario and how to do that really safely. Does that answer your question?
Yeah. I want to keep this thread going for a second, Carrie, just because it's so vital to me, because it's that first touch point. In your opinion, is sex trafficking a violent crime that would lead the victims to, at some point, need medical support?
Absolutely, it's a violent crime, the most violent crime. And they do need medical support. And when they come into the emergency room, they're probably in a very bad place because I don't think that they don't normally have access to medicine. They don't get to come and go as they please to get services. So somebody's either forcing them to come in for something that needs to be taken care of so they can go back to their job, whether it's a sexually transmitted disease or an infection. They want that treated and they want them to be able to leave and to continue doing their work. And yes, it's a very violent crime. It could lead to, if you're talking about labor trafficking, talking about major traumas that they could be enduring, medical conditions that have been going unnoticed and uncared for a long period of time. So by the time they get to us, they are in probably their worst condition.
What are some of the things, if you can divulge, that you've seen? What are some of these things? Are they scrapes and bruises? Are they STDs? Just highlight some of the things tangibly from a professional in your field that you or maybe associates of yours have seen in the ER.
So signs of abuse, tattoos, very large tattoos is a sign. Things like things that say daddy, those are red flags of trafficking. Asking about tattoos is really important. If they have scars, asking about their scars, what they're from, surgeries they may have had, because a lot of them may have had some kind of emergency procedure. Also just signs of trauma, head trauma, cigarette burns, lots of pelvic infections. Sexually transmitted diseases is the most common thing that I see, and pelvic infections. I would say that the last 3 victims that I've had in the emergency room have all been sexually transmitted infections, as well as drug addiction. So a lot of trafficking survivors have abscesses that they develop from skin popping heroin. Heroin seems to be a very choice drug in the sex trafficking world. So they'll come in with very large abscesses and infections that need to be drained. And when you start talking to them and asking them about their addiction, sometimes that will lead you to hearing why and what started their addiction, and will actually allow you to have a conversation about trafficking. It may be the reason why you identify somebody is because of drug addiction and questionings and complications behind that.
Carrie, what is the legal environment? Crystal, a lot of these questions are off the list. What is the legal environment under 18, over 18, that you as a caregiver, first responder, are working within in that emergency room? I mean, are your hands tied with a minor? I mean, has the laws changed? What can you do when you identify this child? You know, this is trafficking. That's a pimp. I feel it. I know it. I see it. I mean, what do? You report to the authorities? May you ask her questions? Does she have to say, help me? Can you call the police to the ER? Help us understand a little bit of that. Okay, now I've identified it. What's next?
Well, for a minor, as healthcare professionals, we are mandatory reporters. So if you're 17 and under, we must report what's going on. So that is a conversation. If she was my patient, I would still have an interview with her and a physical exam, and I would ask any adults or caregivers to leave the room to speak with her. She may or may not say anything to me, but if I'm concerned, all I have to have is a concern, and I can report this. That's all I have to have. If I know what I'm looking for and I have a concern for trafficking, I can report it. So what that means is really a law enforcement. And so what we do as a nonprofit is we help hospitals be able to know how to report this and who to report this to, so this is done well and the appropriate people can respond to this.
Are you able to at that point prolong your interview with the girl, your examination? Do you call law enforcement can you call them onto the site if it's a minor immediately, or is it more a matter of, I'm going to report and collect as much intel as I can, how she looks, branding, tattoos, what it said, all these things, and it's basically a matter of, she was here. There may or may not be facial recognition at the hospital entrance, etc. Or can you actually prolong the examination and panic button, call enforcement in on site?
Yes, you can absolutely. You will be calling law enforcement on site. You also have to report to CPS if it's a minor. So those are the two things that we are mandatory reporters of. But as far as extending any kind of interview, yes, you have the ability to have an interview that is extensive, go in there as many times as you need to talk to her. You're going to do whatever it takes to keep her safe, to feel her like she is going to be well taken care of, and decrease her anxiety and the trauma she's been through as much as possible. Part of the trauma-informed care that goes through that is to decrease the stimuli in the area that she's in. So that's a conversation that you have with her team of providers, everywhere from maybe lab to radiology, if you're getting studies, to your nurses that are taking care of them, to maybe the other physicians that might be in the room. Everybody needs to know what's going on so everybody can respond in a trauma-informed way. But whatever we need to do to keep the patient safe, we will do. And we can do.
What happens in that scenario when the training is not there? It's more just a situation of, here's a great opportunity to intervene, and it's missed because the caregivers, not that they don't want to, they just do not know what to look for. Is that the case?
I think that's exactly it. It's and I can say this from a personal experience because I have never seen a trafficking survivor until this last couple years, and it's because I have the eyes to see them. And if you don't have the eyes to see them, you really walk away with, something's not right. But you're not sure what it is. And now that I know what it is, I can now see it. And so I think of all those years where I walked out of rooms and thought, man, something's just not right. But I don't know, one, what to ask. And even if I asked and they told me something, I don't know if I'd know what to do. And I don't know if anybody would know what to do. And so that's really where this has become so important, is that if we can just educate and bring awareness on what this might look like in the medical field, then so many people will start identifying this.
It's going to be a strange question, but because I have a medical background, I'm just intrigued by this. And I'll tell you why, and then you can answer. Are you seeing a lot of UTIs? And typically, that's just a lot of activity in a sexual nature. A lot of OBs I'm talking to, there's repeated urinary tract infections, and this is a weird statement, but it's almost God's way to get a girl into the hospital, right? Because a prolonged UTI gets ugly quick. Because kidney infection it shuts you down. I mean, it's ER. So are you seeing some UTIs or prolonged UTI? STDs, I'm sure, but there's a lot of activity down there for these girls, and so typically, hygiene is not always what it could be, and so UTIs, am I right? Am I wrong?
Yes, UTIs, a lot of times they do come hand in hand with sexually transmitted diseases. So sometimes it's a twofold issue. They'll have a sexually transmitted disease as well as an STI. So I don't know. I think the major red flag in the emergency room, because we don't necessarily see the same people over and over again, we don't follow up with them, I guess, is to look back in their history. If you have a young female who has urinary tract infections, is to look back and see how many times they've been seen in your ER and how many times they may have been treated for that or something similar. And that would be a cue to you to maybe ask more questions. But an STI by itself, I can't say that I see that predominantly. We also, in the facility I work in, don't see a ton of pediatrics. And so that might be something more that is seen in pediatrics. But I just don't see that group of people as often.
Is there inter-network communication at Baylor, for instance? You say coming to your hospital, but let's say she went to Frisco, Baylor Frisco. Is there data in the network where you can flag her? Well, she hasn't been to my location, but she's seen a Baylor network hospital 4 times.
Absolutely.
Okay.
Yeah, you can look up any Baylor facility for the most part. You can see in your log. So when you look up the patient's history, you can see how many times they have been at the facility or facility system that you work for. And that's usually across the board with major hospital systems. You should be able to see that at some level and track their labs. You should be able to see everything. The x-rays they've had, radiology they've had, CAT scans they've had, prescriptions they've been prescribed. You can ask them if they were here or somewhere in the last couple of weeks. You can ask, did you get these prescriptions filled? Did you get taken care of this medical problem? Did you follow up for whatever you were here for a month ago? So you have access to all of that information.
Can you just one hair on her glasses?
Do you want me to move it?
There you go. You can do it.
Keep doing it. Go
I
ahead.
think I can see it.
And Carrie,
You
can I
can
ask
see
you just going forward, I just want to create a little bit of an angle. Just move your body just a little. Point
This
your
way?
knees that way just a little.
This way?
There you go. Okay. Thank you.
Okay, yeah.
Okay, we're going to continue.
Fuzzies.
Okay.
Every hospital has a network.
Okay, we're still rolling.
Yep. So Reclaim611, the work you do as a nonprofit is not just tied to Baylor. It's to all caregivers. Is that right?
Yes, sir.
How do they find you? How do you interact with them? What is that process?
Well, really the last 2 years is us going to hospitals and using the network that we have and the background that we've had. And, as there's 3 co-founders and one is a pediatric nurse practitioner. I'm an adult nurse practitioner and family. And our other co-founder is a long-term ICU critical care nurse. So throughout this Metroplex, we have worked at several hospitals and know the systems and know administrators. So for us here, we have just been reaching out anywhere we can to let people know that they need training and then what we do. We kind of started by just going to emergency rooms and asking to do their education board before we ever really had a nonprofit. Can we go and use your education board and do it on human trafficking, just because we want to? And then it kind of stemmed into learning more and more about what this looks like in healthcare and our profession really needs help. And so that turned into creating a nonprofit in order to do that so that we could go to any hospital, any urgent care, any healthcare facility and talk to them about how to train them to have the eyes to see these victims.
Carrie, is it being received well? Are you getting support from the institutions? Or are you getting pushback?
Both. Everybody knows this is a problem at this point, to the sense that I think within the social media and just media in general, nobody can really say I haven't heard of human trafficking. But when it comes down to, does it really happen here? Does it really happen in my hospitals? People are not aware, and not everybody believes that. So when you discuss this problem, people's eyes are opened, and it's a human rights issue. So I don't think anybody can say, I don't think this is a big deal. So that part's not so hard. Really, the hard part is getting this to be mandatory education. Because it's not just emergency rooms that need this education. These patients are landing all over our hospitals. They're having babies in labor and delivery. They're in the emergency rooms. They're victims of trauma. They're in ICU. You know, they're in locations in the hospital. They may be there for weeks at a time with plenty of opportunity to have a conversation, where nurses and providers are seeing people coming into their rooms. They see the kinds of people that are visiting them. All those things are building a picture of what could be going on. And so if everybody's educated in that, that's really what needs to happen, because that's where change and impact's really going to be made, and that's how we're going to end this problem.
With that being said, I'm not aware of a nursing school in Dallas. I don't think SMU has a nursing school. I don't think so. I don't know. I may be wrong. And I don't know if UT does. If Baylor does. Baylor obviously does. But UTA does in Denton. Should this not be mandatory pre-med, pre-nursing, pharmacy, anything in the medical field, semester 1 on college campus? Should this not be a mandatory course? I mean, do you not think we need to fight to get that mandated?
Absolutely. It needs to be mandated across the board. If you work, as far as healthcare, if you work in the hospital, it doesn't matter what you do. I mean, you could be in environmental services. You are in patient contact. And if you have anything to do with patient contact, then you need to be trained on human trafficking.
In Reclaim611. Talk to me about that.
Okay.
How did you get to the name Reclaim611?
So reclaim in general, I mean, we want to reclaim these survivors' lives, these women's lives, these men's lives. 611 is, if you have a 911, so 6, it's an upside down 9. So instead of that being a 911 emergency, we want it to be a sign of restoration. But also it stands for Isaiah 61:1. So that scripture that talks about binding up the brokenhearted and setting captives free. And in the non-spiritual world, 611 is actually like a sign of angels, a sign for angels or new life and new beginning. So it has multiple meanings. But Reclaim stands for restoring every captive by listening, asking, intervening, and mobilizing.
Wipe that arrogance from me.
I got excited.
If you don't mind, go through the name and acronym of Reclaim again. What does Reclaim stand for?
Yeah, Reclaim stands for restoring every captive by listening, asking, intervening, and mobilizing.
Do you have enough staff in your program? What are some of the needs you have at Reclaim611?
Oh, well, we have lots of needs. I mean, we're a new nonprofit, so really there's only 2 of us that run this right now, and we pretty much do all the education and develop the educational curriculum to teach healthcare providers. So what we really need is funding, and we really need hospitals and hospital systems to want this education for all of their hospitals, so that we can start getting funding to start training medical professionals that need to be trained. But we go to schools. We've done med student courses, kind of anywhere who needs training and wants training that has to do with medicine or nursing. The two of us do that.
Is this a program that could be implemented in the firefighting community? Good. As for, obviously, police departments
Right.
also have a first responder responsibility, but firefighters and EMS so often work hand in hand. I mean, you can't, if there's a road accident, you've got an ambulance and a fire truck. They're the first ones, even before the police. And so these guys have some sort of medical training. So could this be adapted into the firefighter community?
Absolutely. I mean, they see things that we don't see. And so that handoff from the ambulance, EMS, to the emergency room is really vital because they could tell us so much information on where they were picked up, what the environment looked like. So many pieces that are it's just another piece of the picture. So they absolutely need to be trained. And Reclaim611 is just waiting for that one person who really wants to take that on, because we do believe that it's really powerful for somebody to take and speak to their own profession. And so for us, I don't necessarily understand the firefighting world, EMS, and that's not my job. And so it would really be great for people to rise up in their own professions, to want to teach others, just to make a bigger impact so they understand the person that they're talking about is a little bit more credible.
What is this experience, this roller coaster learning curve you're on, what has this meant to you? How has it impacted Carrie personally, and maybe as a mother? How has it impacted you, you're a mom?
Man, that's a big question, but it's my favorite question. So about 2 years ago, the first patient or survivor I ever identified in the emergency room, I gave her my information. And she had been previously trafficked while she was an adolescent. She's a survivor of being molested her entire childhood. Because of that, a heroin addict, been in jail multiple times. But currently, she wasn't being trafficked. And that day, there was no resource, there was no piece of paper, there was nothing that I could give her to help her in this moment, to fix all of these problems. But I just offered her my contact information because she really just needed a friend. So she took me up on that and kind of became a mentor to her, even though I think I was mentored more than she was over the last year. And she was working in a restaurant, and she came in contact with a friend that she had known from kind of the drug world. And this woman was pregnant, and she was probably about 35 weeks pregnant at the time. And she confided in my friend that she just couldn't stop using heroin. And she knew her baby was going to be taken away from her probably by CPS when she delivered, and that she really just wanted better for her child. So my friend gave me her information and said, would you just call her and just talk to her and encourage her? I don't really know what to tell her, but maybe you could help. So her and I talked for a little while, and it was just so evident that as much as she just wanted to not be using, but she was just not going to be able to stop. So we talked a little bit about what this looks like, and my husband and I offered to adopt her child. And it was one of the most beautiful moments of my life. I mean, this was a woman who has had so much trauma in her life, and she was so excited that someone would want to care for her child, her unborn child, and that she was going to be giving it to a safe person. And that she would be greatly loved. So in about 2 weeks, we actually got a adoption lawyer here in Dallas, and she was born 2 weeks later. She was born into addiction. She was in the NICU on detoxing from opiates for about 20 days, but she's a fighter, and she's like the most beautiful little girl you've ever seen, and she's thriving and doing so well. So her name is Willow. And when I look at Willow, She's a reminder to me every day to stand up for this injustice. Because when you stand up for trafficking, you're not just standing up for those that have been trafficked, you're standing up for the vulnerable. You're standing up for the addicted, the abused, the unwanted, the unloved. You're standing up for so many things that these people experience. And it's just not trafficking by itself. It is so many issues. And so every day she's a reminder with my 4 small children and all of what that looks like, that to keep fighting, to keep doing this, no matter how many doors close on me and how many hospitals say, I don't think that's important, or that sounds great and never call me back. It doesn't matter, because I'll keep pushing and I'll keep fighting because it matters. Every life matters. And I'll do it until the Lord takes me off this earth.
Carrie, can you share your website with us, how people can reach you? And then if you can end with just again your name, last name, and Reclaim611.
Yeah, our website is www.reclaim611.org. And my name is Carrie Schirato. What else did you ask me to say?
Just give me again, my name is Carrie Schirato with
Reclaim611.
Reclaim611.
Okay. My name is Carrie Schirato with Reclaim611.
Yeah, I want to ask you to one more time.
Okay. My name is Carrie Schirato with Reclaim611.
Cut.
Okay, I'll type